Hello folks, this is Harley with the LibreHealth EHR project, which just to save time I'll be calling Libre. In this video I'm going to show you how to use the provider's orders form in a patient encounter and how to transcribe that provider order. This workflow is how providers record their orders to the clinic staff to perform particular patient care activities, such as sending a referral to another provider or sending a patient out to a lab. Medications are a different sort of provider order that have different transcription requirements, so they are covered in their own tutorial. Please note that the EHR provider's order form is a combination of some new capabilities added to older functions of the module that is named procedure orders. So some naming overlap has occurred, which might be a little puzzling, but I'll point out these items as we go along. Okay, let's do this thing. Okay, here I am logged in as Dr. Julius No in an encounter for our patient Crystal Coleman. Okay. Now, during the patient encounter, the provider performs the exams and other procedures, which are recorded in the forms in the encounter summary. Then a SOAP note is written describing the visit, and here we have one already written. Let me open this up to show you. Now, a provider's patient care order has two components that must be legally verified: the order itself, which is in the SOAP note, and the transcription or execution of that order. Now, in the plan section of the SOAP note, the provider must state their intention to order a procedure. Let's say the patient is being sent to an outside radiology clinic for imaging. Here's the order for the CAT scan. CAT scan, and it's going to be head, okay. Okay, so let's just close this back up. Now, in the US at least, the provider must e-sign this SOAP note containing the provider's order to make it legally valid. Ideally, they sign it as soon as it's written, but they may have reason to wait. When the SOAP note is e-signed, the order is legally verified. The transcription verification, I'll show you here in a minute. Now, still in the encounter summary, after having written the SOAP note, on the encounter menu up here, the provider clicks on Admin Procedure Order, and the order form pops up. Now, in the top drop-down, select the order type. We're doing imaging. And these other order types are just what Libre comes with. When your facility is first set up, the system admins can customize this list with your practice's own order types. Okay, so let's see, imaging. Now the provider enters the ordering provider, and this list is populated with all the clinic's users who are specified in their user profile as providers. And this ordering provider defaults to the logged in staff if they're a provider. Okay, the next field, sending to. This is the agency that the order is being sent to. This list gets its items from both the original procedure order module list of outside resources, if it's been configured, and from the external resources in the facility's address book, which this demo does not have entered, so that's why there's nothing in this drop-down list right here. Okay, the order date is automatically set for today. Internal time collected, that only applies to specimens collected locally and sent in with the referral. If no specimen is being sent, leave this empty. If a specimen was collected, click on this text area and make sure the date and time is correct. Priority is an urgency rating as defined by whatever your practice policies say. Status, skip this unless you're making one of those original procedure orders. Clinical reason is a free text, as in type it in, description of the provider's clinical observations that are being evaluated by the ordered procedure. And so we're just going to say the provider noticed some anomalous lumps. Test description is the free text name of the thing being ordered. And we're doing CAT scan head WWO. Okay. Procedure, this is another of those original procedure order things. Don't use that for this. Diagnosis codes. Search the EMR's installed code sets for an applicable diagnosis code. So we're going to go for a head diagnosis, ICD-10, search, and doc's going to put in malignant neoplasm. Now this order is complete. Let's check the buttons at the bottom of the form. First one is add procedure. This saves the order that was just made and gets the form ready to add another order to it. It duplicates some of these fields as being empty, and you fill them in the same manner that the other ones were filled in. Okay. Print directly prints out the referral form if the practice's policy allows for that. It may be policy that referrals must be handled by a transcriptionist. Okay, skip over that button there. Save and transmit directly transmits a referral form under two conditions. One, if the policy says it doesn't need to be transcribed, and two, if some transmission interface has already been set up with that referral source. Okay, so the save button finalizes and commits the order to the encounter form. So we hit save. The provider is now finished with the order form. Okay, as I say, in U.S. clinical practice, providers' orders are typically processed by transcription staff. They make any appointments that are ordered, and they fill out the forms to be sent off, and then indicate in some legally verifiable way that the order has been carried out or transcribed. Now, in Libre, transcription is indicated by the transcriptionist e-signing the provider's order form. However, some user groups do not have permission to e-sign forms. If the transcriptionist belongs to one of those groups, for example, the front desk or is a clinician, the EHR administrator can add the MIPS reporter access control to a trusted staff's permissions. Now, for your information, that permission is found here in the user profile in this access control list. Now, here I am logged in as Walter O'Reilly, the clinic's transcriptionist. Radar learns that a patient has an order that needs to be transcribed. One of the ways he could learn about that is from a report that Libre has that lists all the clinical encounter forms that have not been e-signed. This report will include any provider order form waiting to be transcribed. So from the main menu, Radar goes to Reports, down to Visits, over and down to Encounters. And let's clear away some of these tabs. And the only things on this screen that need to be set to get the list we want are the date range from, well, and just to have a few results here, let's make it back a little while. From, and then to is the end of the search range. And to include orders written today, you got to make the to date in the future, like tomorrow. Okay. Select Details, select Not e-signed, and click Submit. Now, this encounter report can be run as part of a daily audit or whenever it's needed, since it doesn't change any of the information. Here we have the unsigned forms in all the clinic's patients' encounters. See, looking towards the right here, looking in the form column, we see several SOAP notes that have not been signed. A chart audit would report to the provider that these SOAP notes need to be e-signed, but for Radar right now, the only forms he's interested in are those procedure orders. Okay, you can print out the report here with this button if it's a long list, or just make a note of the patient name and the encounter date in these two columns here. So we're going to go find Crystal Coleman. Here we're going to bring up her record summary, and we're going to go get that encounter, and here is this unsigned procedure order, or provider's order. Okay, Radar clicks Edit to open the order form and sees that this order requires a referral form to be made out. So, at the top of the patient's summary screen, he clicks Transactions, and then on that panel clicks Add to start a new referral form, and then you copy and paste the data from the provider's order form on the right into the referral form's blanks on the left. Now let me show you a table of how the differently named text areas in the two panels correspond to each other. Right there. Okay, and you can grab a screenshot of this and print it out, or you can go refer to the written documents in Libre's documentation wiki. Okay, from the right, the ordering provider goes to Refer By on the left. Sending To on the right goes to Refer To on the left. Order date on the right should be the same as the referral date on the left. Internal time collected on the right is only used if a specimen is sent, and if it is, enter the time as free text in here in the reason text area on the left. Clinical reason on the right goes to reason text area on the left, and you look up the text description from the right in the CPT-4 code search tool in the requested service on the left. And so we're looking up CAT scan and CPT-4 and hit search, and here's the requested test is CAT scan head without. And the diagnosis code from the right is entered into the referrer diagnosis on the left. If you're sending vitals along, print them out from the vitals form of this encounter and include them in the packet. Select yes or no. Okay, if nothing's being sent. Now, don't worry, one of the first upgrades to this form is going to be to make it transfer all this stuff automatically, so stay tuned. Okay, when you're done, click Save on the referral form on the left. Okay, and then Radar closes the provider order display on the right by clicking Cancel, and then e-signs that form. Procedure order, this one right here. E-sign, passphrase, let's just make it radars and sign. And I could enter any note, any relevant note in this area here that might be necessary to know. And click sign, and there's the procedure order e-signed. And that is the second required legal verification that the provider's order was properly transcribed. Okay, now this referral is ready to send off, and that's the whole provider's order workflow. Thank you very much.